Good morning, Delaware. What's happening? I'm your main man, Big Iv, the talk of the town, Mr. DETV. And as you know, we love small business. So it's such an honor to have these amazing superheroes in the plaza, on the plaza today. And they're here because of the Pete DuPont Freedom Foundation. If you don't know, the Pete DuPont Freedom Foundation is an entrepreneurial oasis, if you will, an incubator for not just creators, but people, business owners that have wonderful ideas. And here to talk more about it, I have the superhero herself with the pink cape that just floats through the plaza, Lynn Roberts, program manager of the Pete DuPont Freedom Foundation. Lynn, how are you?
Good. I've been happy to be here. Thanks for having me on.
Thank you. So tell me, what's your superwoman pose?
Superwoman pose, I'd say like this.
Okay. And a new thing that we're starting is, What's your favorite quote?
Favorite quote?
Yeah.
Oh my goodness.
Mm-hmm. Yeah, put you on the spot, didn't I?
Yeah. I think that you're only in competition with yourself.
Damn, that's a good one.
Yes.
That's Lynn 516.
Yeah.
So tell me more about the Pete DuPont Freedom Foundation.
Yes, so the Pete DuPont Freedom Foundation is a wonderful statewide nonprofit organization serving small businesses, bold ideas, and entrepreneurs across the board. So we have a couple different signature programs, E3, which is our equitable entrepreneurial ecosystem, and then Reinventing Delaware, which is why I'm here today.
Oh my gosh, Reinventing Delaware. There's a bunch of organizations that's well known that, had to start with the Pete DuPont for this. And that was, I know one was Marquivas and Nerd It Down.
Yes.
The other one was the Work Group, what Logan Herring is doing over on the north side of town, and a bunch of others.
Yes.
So today we're celebrating, who are we celebrating today?
We are celebrating the Delaware Health Empowerment Coalition. This is our 10th year with the Reinventing Delaware program. So they were just the nonprofit track winners, and we were able to grant them $15,000 not too long ago.
I'm gonna need a loan. No, I love those ladies. Those ladies, and they're ladies. They are superheroes amongst themselves. They give so much to the community, right? Award winners. They've just been a good cornerstone of bringing health back to the community, where they could have been doing anything else. They said, you know what, we see a hole, we need to fill it, and this is how we're going to do it. Was the decision hard to get them that $15,000?
I would say it was hard and easy. So we had a very tough competition this year between the Delaware Health Empowerment Coalition and the Woman Best group. So they're both doing really, really phenomenal work in the state of Delaware. One focused on housing and the other focused on holistic healthcare models.
Jesus, I love that.
Yes, we came out with two heavy hitters this year.
Yeah, especially when government is trying to take everything away. Delaware, you guys over there are building Delaware.
Yes.
How can other organizations get it, learn more, or a website, social media, they can learn more about this program? Because if a small business, a business with a great idea could come out the gate winning, that puts them, it's not even about the money. What else, what other resources do you give them?
Yes, so we're heavily tapped into the entrepreneurial landscape within the state of Delaware. Through both of those key programs, we're able to serve small businesses. So think across the board, if you need financial, HR, marketing support, if you need help negotiating contracts, it's very hard as a small business owner and very time consuming to see what outside support you might really need. So we take a lot of that legwork and add capacity to your organization. So that's done through our client success manager, Jonathan Barnes. So we could definitely get you hooked up with him and get you plugged into the ecosystem. If you have a small business that might not have a new innovative idea, but you're up and running, you know your craft well, and you need help to scale. And then on top of that, if you do have an innovative idea, the submission window is open to apply for this year's Reinventing Delaware program. So we're wrapping up the 10th year, but we will be moving into the 11th year program. On November 18th this year, we will be having our kickoff dinner.
I love it. So let's get right onto it, because we have April on the other side of the studio with the amazing superheroes. April, how are you?
I'm good. How are you?
How you doing? April, looking at you. April, how are you? What's going on over there?
Today, we're excited to bring you a special segment about Reinventing Delaware, a program powered by the Pete DuPont Freedom Foundation that uplifts bold, game-changing ideas aimed at improving life here in Delaware. Joining us this morning is one of this year's standout finalists, the Delaware Health Empowerment Coalition, also known as DHEC. Did I say that right?
That's correct.
Awesome.
Yep.
All right. This physician-led nonprofit is on a mission to reimagine community healthcare by bringing culturally competent, patient-centered care directly to the people who need it most. They're already making a huge impact across the state, and their vision for the future is just getting started. So joining us are two of the powerhouse founders behind DHEC, Dr. Velma Scantlebury and Dr. Sydney Teal. Dr. Scantlebury, she's amazing. She made her history back in 1989 as America's first Black woman transplant surgeon, performing over 2,000 life-saving transplants. Did y'all hear that? 2,000 life-saving transplants, and now leads the medical side of DHEC. Dr. Teal, also amazing, has spent the last 2 decades not only participating, but also steering patient-centered care across 25 clinics in multiple states, shaping the organizational goal of bringing holistic healthcare directly into communities. Like, that is amazing.
Well, thank you so much for having us. You know, we were on a journey. We came together right after the pandemic, and so we were vaccinating or educating about vaccinations. And we moved on to, you know, the idea was to really encourage our Black and brown residents of Delaware to get vaccinated. And so we were called upon. And so we were out vaccinating and hearing conversations with patients and community members, and realized that there really was a need to develop to bring together the kind of medical care that would foster trust and really make a connection between patients and providers. And we know in listening to our patients that they just want to be heard, they want to be seen. They just want, and we know that, and our tagline is restoring trust in healthcare, because trust is the basic foundation of how you take care of a patient. If you have that trust, they can be more honest. They can be open, and we want not to be judgmental. We want to be transparent, and we want to be able to provide that care. We saw our need to have that, to make that trajectory in the sense of a medical home, Delaware Health Empowerment Coalition, formerly known as Delaware Health Equity Coalition,
Right.
and to have a culturally sensitive medical care.
Okay, I love that.
Yeah.
Dr. Teal?
Sure, I'll just build upon what Dr. Scantlebury shared. You know, by background, I am a primary care physician. By background, Dr. Scantlebury is a transplant surgeon, as you shared. We have 2 other partners, Dr. Joan Coker, who is an ear, nose, and throat otolaryngologist, and Felicia Stallings, who is an audiologist actually by training.
Wow.
And so the 4 of us came together, and as she shared, we formed the Delaware Health Equity Coalition in response to really what we were hearing from the community about their needs to be more connected to care, to really help them to understand that the foundation of really good health care, and not only getting people to good care, but keeping them in good care, is trust.
Right.
And so, as Dr. Scantlebury shared, we work very diligently with our patients to establish that relationship. And we really think about it being more relational, not transactional. And unfortunately, a lot of medicine has become very transactional. And so we are doing just that opposite, and delivering healthcare to our patients and to our communities. The other piece that we do, and I want to make sure that we don't forget, is where we started, our roots, which is we engage in a lot of wellness events. And so I think last year we had close to 50 community wellness events that we participated in and around the state, blood pressure screenings, cholesterol screenings, vaccination events, giving health education, promotion, and awareness, narcotic education and awareness, substance use disorder screening as well, and referral to treatment. So we really think that that's another huge part of the work that we do in addition to practicing medicine.
all that sounds amazing. I'm like, when do you guys have time to do anything else personal? Like, what kind of books do you read outside of the medical books? Like, you guys' lives sound just busy all the time, but in a good way. Like, I'm just inspired by all of the things that you guys are doing. And as I hear what you guys are saying, I did have some pointed questions, but you guys like hit the mark. You told me what's inspired you. You told me, you know, how this evolved, how you guys got here. But tell me how you feel about it. Like, so right now you guys are the Reinventing Delaware finalists. How does that make you feel?
Sure. We're pretty overwhelmed. I think for us, we started this idea about 3 years ago, conceptually, and we sat around and had lots of meetings to think about how would we create the framework and the model, and to then see it come to fruition a little over March of 2023, started seeing patients. We were fully credentialed, but then to be able to have this opportunity to participate in this entrepreneurial competition. You know, as a nonprofit, we're thinking, you know, gosh, who would really be interested? We're a medical practice. You know, there are medical practices and healthcare systems and so forth. So I think we were pretty overwhelmed to think that our idea would bubble to the surface as the top Reinventing Delaware recipient, you know, and a finalist. So overwhelmed is probably the top word for me when I think about it. Yeah, it's been a big deal.
It is.
Definitely.
How do you feel about it?
Well, I think we truly have been blessed to be able to be the finalists and win this award with Reinventing Delaware. And it's a unique opportunity, one, to spotlight what we're doing and our emphasis on changing the trajectory of how medicine is delivered. Right. And one of the things we want to point out is with our medical home, while we are practicing primary care, we also focus on mental and behavioral health. And we actually do have therapists that in the same facility we are, and that's so important to be able to have that kind of practice where patients feel psychologically safe. They can come here, we can judge-free zone, we can take care of them, we can multi-generational, we can see your kids, we can see your grandma, we can see, you know, everyone related to you. And our goal is really to deliver that. And I think it's awesome that that we're recipients of this award that hopefully will open doors for us to be able to expand our practice.
Right.
And the goal for us is really to use this as a launch to be able to grow and be in all 3 counties in Delaware.
Right. I think.
So go ahead.
I was going to say, well, the other thing is about winning this award, and I think Lynn Roberts probably touched on this a little bit. This really is sort of a launch pad for us. The Pont Freedom Foundation has so many other offerings and opportunities for small businesses and entrepreneurs like us. You know, we're doctors, right? let's be honest, we're doctors, you know, and we do a little of this and a little of that,
right?
But really having a partner like, you know, Pete DuPont Freedom Foundation to say, listen, we can also help you as entrepreneurs. Let us help to guide you. Let us help you with resources and other capabilities that continue to expand your vision and your mission.
Right.
And so that's been really exciting as well.
I'm sure. So what makes your concept innovative, and how is it different from what currently exists in your communities or in our communities?
In a word, it's trust. We started to highlight this. So when we were really talking to communities, to patients, even now as we continue to have conversations, and as patients are coming into our office, we don't have a huge social media presence. We again do a lot of on the ground work, meaning that we are attending wellness events, community events. We talk a fair number of different places about health and wellness and so forth. But when we're talking to our patients and we say, how did you get here today? We always ask them. It's interesting that they'll say a friend told them, a neighbor told them, and even insurances are telling them about us. And what they will say either at the end of the conversation or during the middle, they'll stop us in the middle of a conversation and say, see, this is why I'm here, because I feel like I can trust you. I can share information with you. You're actually sitting, you're listening to me, you're making eye contact.
Yes.
You're talking with me and not at me.
Yes.
And I can tell that you really love what you do because you are invested.
Yes.
And that personal investment is what we're trying to change. That is, I think, the uniqueness. It's not to say that any clinician is ever not willingly or knowingly trying to practice bad medicine. We're just saying we're being very intentional. We want our patients, we want our community to know that we want to know what motivates them. We want to know what doesn't motivate them. We want to know how can we connect them to the resources that will get them continuing to be invested in their personal health and wellness.
Right, and it really boils down to if your patient trusts you, they're more likely to share the barriers and the things that keep them from wellness. Sorry. And they're more likely to be compliant. They're going to come back because they see that you have a vested interest in it. And with those open conversations, we can then identify how we can help them better. When they're open up to us, tell us the things that are, whether it's problems with transportation, whether they can't make it because they don't have a babysitter, or they can't afford their medication. So rather than saying you're non-compliant with your medication, it's tell me you don't have the funds, or I'm stretching my pills. So by understanding where and being where they're being proximal to them and understanding where they're coming from, then we can be more helpful in eliminating those barriers.
Okay. So I guess I have a question. Like, have you guys won any awards? Have there been any accolades that have come to you guys outside of this particular foundation?
Yes, we became a National Health Service Corps site designated site, meaning that the government recognizes our practice as a location where clinicians can come and get loan repayment, which is huge for anyone who's in healthcare. Yeah. We won the Myasthenia Gravis Foundation Community Partner Award. We won the Cayeta Community Partner Award.
You just got something yesterday on your desk.
Oh, well, that's not really an award, but what else? I think we've had a couple. I'm trying to think of some other awards. And then, of course, grant funding. We've been very, very fortunate to receive grant funding from the Lieutenant Governor's office, the County Executive's office.
That's amazing.
From Highmark. Huge shout out to Highmark, actually. Former leader, Nick Moriello, who the Blueprints grant, they really actually launched us. It was Highmark that gave us the seed money to be able to launch our project and launch our practice from the very beginning. Bank of America has been an incredible partner for us as well. But I think the greatest award we get are the patients to come in. Honestly, we're at 1,300 and growing by leaps and bounds.
Okay.
So truly, every interaction that we have with our patients is probably the greatest award we could have.
Right. Well, it has been a pleasure talking to you ladies this morning. I am just overwhelmed with joy of all of the things and the attributes that you actually bring into the community, and for all of the work that you'll continue to do through this initiative. I am super excited. We're going to go back over to Ivan and see what he's got cooking over there for us in Good Morning Delaware.
Oh my gosh. Ladies, great job, ladies. Thank you so much again for what you're doing. I remember in 2019 when when we met and you were like, this is what we're doing. We're going to make sure that we go back to the community and give and give and give, because you did not like how the system was set up. Was it 2019?
No, it was 2021.
2021, yep.
Okay, that's right, 2021. And since then, you've been rocking and rolling, straight rock stars. So again, thank you for everything, for what you do in the community. And it means so much. And I just want to, do we have any flowers to give them or anything, April?
Oh my God, we should have 1,000 flowers to give them. These ladies are phenomenal. I am just in awe of everything that they have done and everything that they will continue to do, here in the heart of Delaware, in these communities where they absolutely need it the most. And when I am a little taken back right now, you know, at just the generosity of them both. Like it's just amazing.
Yeah, it's definitely world changing and purpose led and mission filled. So ladies, thanks again for coming on Good Morning Delaware. And thanks, April, for knocking that out the park. And Lynn, thank you. Thank you. Is there any last comments that you might have for people that need to sign up or need to learn more?
Yeah, thank you again, Ivan, for having me today. I would say number one would just be to get your bold, innovative, creative ideas in. We're looking for anything that can potentially improve the economic state of Delaware and beyond. So definitely go ahead and submit on the P2 Pont Freedom Foundation's website. And then be sure to follow us on social media. We're doing a lot of great things for the community and small business owners, and that's our passion. So. All
right. All right, for more information, Pete DuPont, freedomfoundation.org. Did I get that right?
I think so, yeah.
I think. All right, for more information, make sure you follow up. Tell them Big Ive sent you, and thank you for watching. And don't forget to like, subscribe, and follow. Tell a friend about all of this. It's a lot of it. All right. So with that being said, we're out of here. We'll see you next episode.